We are delighted that you're here. I'm Glenn Macnow from 94 WIP. This is my radio partner, Ray Dinger. And tonight, with our friends from Cooper Health, we are going to present a sports movie / men's health night. I hope everybody's enjoying your meals. And so here's what we've got planned tonight. First, let me introduce the docs that we have on stage here, the great doctors from Cooper Health. On the far left, Dr. David Gelb, who specializes in sports injuries. Next to him is Dr. Christian Squilante. There you go. Oncology. Next to him is Dr. Lombardi, Dr. Joseph Lombardi, vascular surgeon. Dr. Alan Septel, the head of Division of Urology, Cooper Health. My friend, the heart specialist, Dr. Phillip Koren. Wow. And by the way, one of our other friends from WIP has crashed the joint tonight. Where's Al? Al Morganti has joined us. Where are you, Al? There you go. Al is in the bar, so if you need somebody you want to buy a drink, Al's your guy. All right, so here's what we got today. As I said, Ray and I are going to show clips of sports movies. Actually, Ray, why don't you talk about how we wrote the Ultimate Book of Sports Movies?
The Ultimate Book of Sports Movies, which is for sale here, was an idea that Glenn actually came up with as a result of us doing our radio show together for as long as we've done it. We always noticed that whenever in the course of a show we would begin to talk about a sports movie that we had seen, or one that was coming up, or talking about one from the past, the phone bank would just light up with people calling in with their opinions and wanting to talk about a movie they liked or disagreeing with our opinion, but it was always a hot button topic. And Glenn said, you know what, based on the reaction that we're just getting on phone calls, I think we have a book here. We just did a book on sports movies. So I said, all right, well, if you can find a publisher for that book, I'll collaborate with you on it. And sure enough, we did. And a few years ago, we wrote the Ultimate Book of Sports Movies, in which we picked what we felt were the 100 best sports movies ever made. And we ranked them 1 through 100. And we also had some chapters on what we thought were the worst sports movies, and which actors were the best athletes, and which athletes were the best actors. We took it in many, many different directions. But the book was pretty successful, and out of the book came the idea for having this kind of program. So what we're going to do tonight is, in addition to talking to the doctors, we're going to show some film clips from some of the movies that actually are in the book, and tell you a little bit about the behind-the-scenes story, how these were made.
Okay, so what we're going to do is we're going to do a little talk from each doctor, talking about his area of expertise and anything that may apply to you. We are going to, at the end of the night, for questions, both about the health issues and about the movies. Hopefully this doesn't keep going in and out. About the health issues and the movies. So it's going to be doctor, and then we're going to show you a clip from one of our favorite sports movies, talk about that, doctor, and then back and forth. So let us begin. And Dr. Koren, you get to go first. Dr. Phillip Koren, who brought his neighborhood tonight, has been a cardiologist in South Jersey since 1991, board certified in internal medicine, cardiovascular diseases, international cardiology, a fellow at the American College of Cardiology. It goes 2 pages with all of his credentials, but essentially Dr. Koren is going to speak for a couple minutes on heart health. Doc, I turn it over to you.
Do you want me to just speak or just answer questions? Okay, so you can tell I catered tonight's event. This is the opposite of men's health. So I think when we think about men's health and heart disease, we have to think about how first you can take care of yourself. And what that means is understanding, I tell patients all the time that you can change your pants, but you can't change your genes, which means you're born with a certain genetics, but you can't really change them. And today, in 2016, we still don't have a lot of genetic options, but we do have behavioral options. So you can modify your behavior, and your behavior would include your diet, exercise, some supplemental medicines that you could take, like aspirin, fish oils, and things like that, regular exercise, if I didn't say that already, and reducing your stress. Since we're talking about drinking and Al's buying drinks, if you have a glass of red wine, there's some benefit to that as well. So we have an opportunity in 2016 to understand that there's a lot of things that you can do for yourself to improve your men's heart health. And most of us are on the same page, and there are going to be common themes where our bodies, our organs talk to each other. And you take care of usually one organ, you're going to take care of your other organs. So I will tell you that there's going to be a common theme for both heart health and for prostate health, blood vessel health, orthopedic health, and the like. So anyway, that's enough.
Let's say I am a man of 40 years old, 50 years old, something like that. I know this is a combination of lifestyle things, but what would you say is the #1 thing that a man, a middle-aged man, should be conscious of to try to keep his heart healthy?
First thing is smoking, no smoking. That would be the first thing I would tell people. Is the biggest modifiable risk factor is avoiding smoking. Second would be diet. And diet would be consistent today. So we've changed our approach to diet. And what I mean by that is that we now know that a Mediterranean, or not necessarily a low-fat diet, but a correct fat diet is the best for you. So if you look up Mediterranean diets, I would say both diet and avoiding smoking. Those are the two major things.
And when should a man decide he needs to see a cardiologist? Obviously a doctor's referral, but if a guy is starting to feel shortness of breath, a little wheezing, little chest pains when he gets up, what should he do?
So I think the best thing to do is to see your regular doctor first, and then if your doctor thinks that you need to see a cardiologist, probably good to get on the horn. But pay attention to your body, and pay attention to your genetics, your family history, and those are the main things. So if you have a strong family history of heart disease, pay special attention and don't ignore your symptoms.
All right, very good. Thank you, Dr. Koren. Thank you. God, it's proud to watch you. It's proud to watch you. Okay, it's time to show the first movie. I'm just curious. I don't know that I want. Do these guys have to stand up and move for you guys to see them in the back? No? They're okay? All right, well, you let us know. Ray, why don't you introduce this first movie because it's your pep talk.
One of the things that Glenn and I found when we were doing the book was many of the sports movies that we liked and that we included in the book always had a moment within them where there was the great pep talk. Sometimes it came at the beginning, sometimes it came at the end, sometimes it came in the middle, but there was always that moment where somebody, either the coach or the team captain or the trainer or somebody, gave a talk that sort of focused everything that the movie was about and sort of summarized it and sort of built you to that big moment of deliverance in the film. And so Glenn and I thought that in long discussions, what was the best pep talk that we saw in any sports movie? And we both came to the same conclusion. And we felt that far and away the best pep talk was the one that was given by Kurt Russell, playing Coach Herb Brooks, talking to the U.S. hockey team before they went out to play the Soviets in the game at Lake Placid in 1980. One thing to keep in mind when you see this is this was not written by some screenwriter or dramatist. The words that Kurt Russell are going to deliver here are the actual words, word for word, that Herb Brooks said to the U.S. team before they went out to play the Soviets in that immortal game in 1980.